Mr. Meach, so here are the different nicotine smoking cessation products that we have available. So as you can see, we have gums, lozenges, tablets, inhalers, nasal spray and mouth spray, which are all known as short-acting nicotine products. And we have also nicotine patches, which are long-term nicotine products. And long-term nicotine products, so what these do is they provide you with that nicotine that you require continuously throughout the day and also while you're sleeping as well, and this is applied as a patch. And the short-acting ones, everything else is short-acting, and they work by giving you nicotine whenever you require it, and they have an immediate effect.
Okay.
So what would you miss most about smoking?
So what I'd miss most would be when I pick up a cigarette and I put it to my mouth and light it. That for me is like a big habit.
So like a hand-to-mouth action.
Exactly.
So in that case, what we have available, we have nicotine inhalers. So this mimics the hand-to-mouth action that you'd get with smoking, and with this one, you would put it to your mouth and you would breathe it in, and you'd get that nicotine dose by breathing it in.
Okay.
Is that something that interests you?
Definitely.
We also have these patches. Is that something that interests you as well? It gives you like a nicotine dose when you're sleeping throughout the day. So what are your smoking habits? When do you smoke?
So
When do you get the cravings?
So I smoke throughout the day. Morning, midday, mostly morning, midday, and I would like something that could just fight the cravings of nicotine throughout the day. And of course, the inhaler sounds good for the hand-to-mouth action.
So the patches here, so it provide you with nicotine throughout the day, so that will reduce your cravings, and also it can help reduce the morning cravings, because you get that nicotine throughout the night. Is that also something you'd like to have?
Definitely.
So first of all, can I ask, just confirm, do you have any allergies at all?
No.
Do you have any sensitive skin?
No, I don't have any sensitive.
Do you have any skin conditions at all?
No, nothing at all.
Okay. So here's the inhaler.
Yeah.
First of all. So this is the inhaler. This is the patch. Thank you. So I'm just gonna brief you about how you would use it.
Okay.
So with the patches, what you would do is you'd apply it onto your arm.
Yeah.
And every day you would need to alternate between different arms. And you need to apply it around the same time every day. So if you were to apply it 9 p.m., apply it the next day again at 9 p.m. and alternate between arms. So if you put it on your left arm, change it to your right arm, and don't put it on the same position. So top of your arm, or middle of your arm, or lower part of your arm. So alternate between places.
And how many days after could I put it on the same place?
So after 7 days.
Yeah.
So after 7 days, that's when you would be able to put it on the exact same spot.
Okay.
You put it previously, and this you would take it for 12 weeks.
Yes.
And after 12 weeks, we can also see how you get along with that.
Okay. And what strength would I go for?
So because you mentioned that you quite a heavy smoker,
Yeah.
you mentioned you smoke about 20 cigarettes a day. So we would go for the upper end. So
Okay.
21 milligrams we can give you.
Alright.
And in terms of these patches, I mean, if you get any kind of skin reaction or anything, then in that case, then please do come and speak to a healthcare professional or come and see us about that if you experience anything like that. And in terms of the inhaler, so like I mentioned, this is something that you put to your mouth and then you breathe it in.
Yeah.
And it's quite simple. And with this one, you would take a maximum of 6 a day.
Okay.
And in terms of this inhaler, so if you get any kind of reactions in your mouth, like any ulcers, mouth ulcers, anything like that, then do stop taking it and do see a healthcare professional, or you can come and speak to us as well.
Okay.
Do you have any questions about that?
No, that's all been good. Are we going to have another meeting?
So so I can follow up with you. Just to mention about the patch, so this is waterproof, so you can use this while you're showering as well.
Okay.
And in terms of these medications, are you happy with taking these?
Yeah, so I just apply the patch.
Yeah.
And every time I just
Apply the patch, and every day you alternate arms, and you
Yeah.
don't put it in the same place every day.
That's fine. And the inhaler, I just use it when I require. But how many maximum could I have a day?
6 a day. So
6 a
maximum
day.
6
Oh, right. So,
yeah.
okay. So I could have 6 of these a day, and the patch lasts 24 hours. I
Yeah.
just remove it, put it on the same time the next one,
Yes.
in a different location.
And in terms of the inhaler, so its action, it's an immediate action. So once you breathe in, you get that. It helps quench that. It helps quench your cravings,
Yeah.
and it just works immediately, and it lasts for about 14 minutes. So it's quite short term.
Okay.
And yeah, like I mentioned, take 6 a day. And is there anything else? Any other questions you have about this?
No, that's all great. Thank you.
So what I can do for you is I can have a follow-up appointment with you.
Yes.
So I can have a follow-up appointment with you next week if you want to.
We can do that next week.
Next week, and I can see how you're getting along, and we can see where we can go from there.
Yeah. That's great.
So next week, I can meet me. We can discuss it, how you're getting along with it next week, and see from there whether we want to meet again or when you would like to meet and so forth.
All right. No problem. Thank you very much.
Any questions for me?
No, that's been great. Thank you.
Okay. No worries. Hope you get better.